Hello and welcome to the CDW Tech Talks podcast. I'm your host, KJ Burke, Field CTO for Hybrid Infrastructure at CDW Canada. And today we're going to discuss technology and innovation in the healthcare space. I'm joined by Tom Stafford, our healthcare strategist for the CDW US, and Dave Schneid, our national healthcare strategist for CDW Canada. Really appreciate you guys joining us. Tom, maybe we could start with you and you could tell me a little bit about your background. I know I was really impressed when we were at HIMSS last year and you knew everybody. So maybe you could kind of talk to us a little bit about that and why everybody knows who you are.
Thanks, Dave, for that. So I'm a recovering CIO, first and foremost, and I'm part of a larger strategy team, just like Dave is up in Canada, of former CIOs, CTOs, CDOs. And I used to be the CIO of Halifax Health in Daytona Beach, Florida. And I was on the provider side of healthcare for about 15 years. Did a lot of really neat things when I was at Halifax, and that kind of got me on the speaking circuit. So I spent a lot of time talking about healthcare innovation, cybersecurity, IT leadership, because if you don't have a good team, you can't get much done. And that kind of put me on the map. And that's why you saw that I knew a lot of folks at HIMSS, essentially. But I do appreciate being on this today and talking to my friends up north. So thank you.
Yeah, we appreciate you, joining us and bringing your insights. I know I learned a lot from you and the team, and we'll kind of get into some of the stuff that you guys do and some of the really innovative stuff that we have available in the US. And then Dave, I really appreciate you joining me today, and I'd like to tell the audience a little bit about your background and what brought you into CDW Canada. And again, I think having you on the team has been great because it just allows us to key in and talk to our healthcare customers and really get to that the meat and potatoes of the conversation with healthcare institutions faster. But if you could kind of introduce yourself and a bit about your background.
Thanks a lot, KJ. And I also want to extend a thanks to Tom itself for actually encouraging me to join CDW. It was the time he spent with me over the period of time, kind of explaining what the healthcare strategists do in the US and their background, how valuable they are in the healthcare space, and especially within CDW. So my background outside of that, I am an engineer, a professional engineer, licensed in Ontario, got my MBA, and I also got my CISSP for continuing education, which helped me with my role at London Health Sciences Centre and St. Joseph's in London, Ontario, where I looked after all of the IT operations and was the CISO for not only the London-based hospitals, but also all of the regional hospitals, which were supported by a single instance of Oracle Health. That's basically set the stage for me in dealing with pretty much anything related to the operations from a technical or leadership perspective within IT and a hospital setting. So that's kind of my background, gentlemen.
Yeah, I think it's good. And what I notice is that when I'm involved in the conversation, and I saw Tom engage with some of our customers, I saw you engage, I saw Tom's team engage. It really is just being able to speak the same language. I know I get excited when I get in front of a mining customer. I'm like, hey, I like this. We speak the same language. We can cut right to the objectives. So I think it's really exciting that we have, you guys and Tom's full team, helping and driving those conversations forward. The other thing that's really interesting is you guys get to talk to a lot of people. And because you're able to get to those conversations so quickly, we learn a lot from our customers. We learn a lot from our partners in the space. And so, I wanted to start the conversation today really around sort of the current state of healthcare. And healthcare is one of those really interesting topics because it's relevant to all of us. Whether we're helping behind the scenes, whether we're talking to the research teams in a business sense, but also individually, we have parents or family members or our kids or ourselves, and so healthcare is really relevant, I think, for all of us. But maybe Tom, if you could start off by talking about what are we seeing currently? What are some of the things that are in flight as far as technology and innovation, and kind of set the current state of things up for us?
Yeah, I'd love to do that. I've just came straight from the Vive conference too. That was in LA. That's a joint, conference between Chime and also Health in the US. It's a great time to be in healthcare. There's no doubt about it. And the reason why I say that is that things we're doing today, we're finally doing it right. when we went through meaningful use and started putting in all the EHRs back in 2010, unfortunately, I don't think we knew where our North Star was, and we were trying to get things in and just assuming they would work. And we struggled, and so, but now there's a lot of changes going on. And it really goes back to the quadruple aim. And that's kind of a summary of what's going on in healthcare today. And it's actually happening in healthcare today. What the quadruple aim is first and foremost is to enhance the patient experience. And secondly, and probably the most important thing, is to prove outcomes. We're trying to reduce our cost of healthcare. And then it used to be the triple aim, but they changed it to the quadruple aim because we noticed too that we needed to also improve the clinical experience. And so today, the AI technology that's coming out, the enhanced functionality of the EHRs or systems around the EHRs are providing better data, better collaboration amongst our caregivers, which ultimately gives a better experience and improves the outcomes for our patients. And if we can get the data to them and everything they need, it will reduce cost too, because we're not doing double images and things like that anymore. And so it's a really good time. And so first and foremost, AI is making changes across the boards for us. Another thing that's happening too is we're finally seeing a shift into cloud computing. And there's a reason for it. If you go back 10 years, and David would probably agree with this, but I was proud of my data center. That was something that was physical, it was there, and I owned it and I controlled it, and I made sure it didn't go down. And then I had another data center, obviously, it was for disaster recovery, but that was a big expense. And with that big expense, I had a big staff that had to maintain that, and it took a lot of my time. And so what we started seeing about 2 years ago is that healthcare IT leaders started realizing, like, hey, the data center is not why I'm at a hospital. The reason why I'm at a hospital is I have to improve applications and technologies so my caregivers can take better care of the patients and the patients have a better experience while they're in the hospital. And so this paradigm shift is happening where most CIOs are now seeing the data center as a commodity. And in that case, it's a lot easier to shift a lot of those workloads up to a native cloud environment like Azure, AWS, or GCP, and not to have to worry about it as much. And there's also some cost savings too, because you're no longer having a surplus of storage and compute and things like that, because you can just turn it up when you need it. We're starting to see that shift happen. There's no doubt about it. Another thing we're seeing too is, at least in the US, our economy is not the greatest right now, and that affects healthcare greatly. And the other thing, COVID obviously increased all the supply chain costs, and that hasn't gone down yet. And unfortunately, we're the only business where your cost of goods go up, you don't get to change your sell price. And so we are seeing a lot of focus around ways for IT leaders to contain costs too. And last but not least is cybersecurity. Every week there's a new ransomware attack. If I go back like 7 or 8 years ago when someone got hit with ransomware, kind of like, oh my God, they got the plague. But nowadays we're getting much more better at being brothers and sisters in arms. And when someone's attacked, we try to help them get back up as soon as possible. And it's no longer an if thing, it is a when thing. And so we're seeing a greater shift too, where you still have to reduce your risk and have the right cybersecurity stack and platforms to protect your data and your user base. But if you know eventually you're going to get attacked, you're going to focus on making sure when you get attacked, you know how to do the right thing and get back up as soon as possible. So that's like the last area we're seeing great focus on is healthcare IT leaders are focusing much more on incident response and being able to reduce their RPO and RTO time so they can get back up as soon as possible and get back to patient care.
Yeah, it's a good point, and you're right. That's what our cybersecurity guys say too. It's not if, it's when, and it's controlling the impact radius. It's having those plans in place. And I just want to double check EHR. I'm going to guess electronic health records.
Oh yeah, I threw out an IT term. Sorry about that. Yeah.
All good, all good.
You got it.
I appreciate that because, like, for me, it's there's so many acronyms out there, and no, that's good. So, Dave, your focus being more working with Tom and the team and understanding what's going on globally and in the U.S., but then having that real focus in the Canadian landscape. What's the current state in Canada, and are we seeing a lot of similarities to what Tom's talking about, globally in the U.S.? I know one of the things I've been really impressed by is the way that Canadian hospital organizations and care providers work together. But maybe you could talk a little bit about the current state in Canada.
Sure, I sure can, KJ. And I really The things that Tom was talking about really resonate, and I think they kind of parallel the situation in Canada. The one main difference, by the way, is the more public nature of healthcare in Canada than in the US. And that does have some limitations in the ability to innovate. It doesn't stifle it, but I think there is a lot of innovation that goes on. And I really resonated with the quadruple aim. I think there's a new movement ahead, by the way, Tom, that's actually adding a fifth layer, and that is adding digital health equity as another component to ensure all populations have equal access to healthcare. In the Canadian context, though, I look at what are the leading elements that are moving forward, and that component that Tom talked about, the ability to digitize the entire medical record, from beginning to end, and the ability to interoperate within the various different systems is the challenge. And I think the better we have at eliminating hybrid health records, the better it is for patients. Because as soon as you have a hybrid health record, that means between paper and digital, you are limiting your ability to improve the quality of care. And the other elements there that we talk about, like AI or artificial intelligence in all the fields, is growing in leaps and bounds. A couple of examples that I know from my experience in London is in the area of genomic research, personalized medicine, that's really moving forward. A simple thing like the application of and use of warfarin for eliminating blood clotting. It is a very genomic targeted ability. Warfarin is basically a toxin. And if your genetic makeup doesn't allow you to accept warfarin, it in fact can kill you. So, and different people with different genetic makeups will tolerate different drugs differently. And that's just one area that they're working on. And I know that's a national focus as well. I think the other areas that I think might be a little different in terms of innovation is relative to the ability to move forward in latching on to available funding to leverage it to innovate. And I think that because of the public nature of it, the groups have to be very creative in their ability to leverage access to the funds in order to try different things, to do proofs of concepts, and to be able to deliver these innovative responses. So it's bridging the gap between the ability to research, like the work that Dr. Kim is doing in London, to getting it out and in a working solution. And I think that it's a very exciting time in healthcare. When I go down and talk to Tom and see the things that are happening in the large scale HIMSS environments, the world is going to change. It's pretty impressive. And we're set for, I think, a very, very big leap in technologies in healthcare that are going to save lives.
Dave, I couldn't agree more with you about your comment about digital health equity. When I was talking before about cost containment, one of the things that's been happening in the US is a lot of our smaller regional or critical access based hospitals have been closing. I think in 2022, 140 closed. And every time one of those hospitals close, it creates health inequities. There's no doubt about it. And so thank God, you shouldn't thank God about COVID, but what COVID did do for us was, it made everyone finally realize that you can do virtual care too. And so we are seeing a lot of health systems that are going into these areas with hospital closures and setting up some sort of more virtual presence. So, when patients are getting sick and their bodies are telling them something, at least they can have a virtual visit to see if they need to continue their care or not. And so we are seeing a lot of that in the US too. So thanks for bringing that up.
Yeah, and I think that we're going to continue the conversation, explore some of these topics a bit more. One of the big things that really jumped out in the healthcare industry, as I've been, learning more from yourself and your team, Tom and Dave here, local in Canada, is when we think about solutions and building, we think about either we've got projects or sometimes we've got teams or we've got services we're trying to develop. And the focus in healthcare on the patient experience and the doctor's experience and the nurse's experience and all the lab techs experiences and how that drives towards providing the best possible healthcare solution for your patients. That's been one of those things that's been really eye-opening for me. And it is an interesting field because it does mean the difference between life and death a lot of the time. So looking at the way that innovation and technology is changing, can you elaborate a little bit, Tom, on the way that that's changing how patients interact with their providers? You talk about the remote accessibility. What's some of the technology innovation we're seeing in the concept around like the home hospital or servicing people, not just in remote communities, but also maybe more regularly because the technology is easier to work with in their homes?
Absolutely. That is a big question. So let me try to break it down as best I can. So as far as some of the technology that's occurring right now that is really helping patients do better engagement with health systems or individual providers is first is virtual care and digital front doors. So because of COVID-19, everybody realized that there was some level of care that could happen virtually. We did it at the time because we were stuck and that's all we could do. So now if you look forward to today, virtual care does still exist, but now I would say it really has its proper place in healthcare. It's utilized for primary care, it's utilized for behavioral health. And so the nice thing is that virtual care is allowing care to still occur and when sometimes it wouldn't. So if a family lives 50 miles away from a hospital and their body starts telling them they're feeling pain, a 50-mile drive might not be easy to do. And so they might ignore that pain and they continue to then ignore that pain until it's too late and they have to go to emergency department. And so by using virtual care and other means like that, it does allow for us to care for patients early on and prevent those more ER type visits where it gets very emergent. And so that's one of the best things that happened from COVID in my mind was really creating the environment where virtual care helps everyone. But in addition to that, we now have a lot of other ways of interacting with caregivers, right? From your cell phone today, you can make an appointment. You can have an appointment from your phone. You can send personal protected data to your physician so they can better care for you. When you get to the hospital, you can fill out your forms ahead of time through your patient portal, which again allows that more efficient interaction with the care provider. Then once you're in the hospital in a care setting, we're giving a lot more, I'd say, power back to the patient, right? So what we're seeing a lot right now happening with technology in the patient rooms is that there's a lot more electronic whiteboards being used. And really the value of that is pre-electronic whiteboard. The only thing the patient had was a remote control for their TV and a telephone. But what these whiteboards do is it lets the patient become more immersive in their care. They understand what is happening during the day at the hospital. Hospitals can send them education about their needs, and that obviously will help them get more ambulatory and back to good health again. So I think all these things are happening right now, which is really allowing the patient to feel closer to the physician than they ever have before. And so we're definitely going in the right direction.
Yeah, and I've even seen instances of, especially in like children's hospitals, personalizing the nursing staff and being able to again create those connections between people. Because I think you're right. At the end of the day, it's not just about the medication and the care. It's also about the comfort levels and having people build the rapport with their healthcare providers and be more open about sharing those challenges and maybe if there's stigmas around what they're having issues with, it's being able to be open and communicate effectively and bring up all of those underlying issues or challenges that they're going through so that the doctors and the nurses can be more successful. It's interesting because I think a lot of time I think about technology like with my kids, and it's like technology pulls us away from being in the moment sometimes, but where you can find ways for the technology to create that rapport, create that communication, make it easier, and then focus more on the patient. That's I think that's really powerful.
Well, and patients are demanding it because that occurs in all other aspects of their life today. So why should healthcare be archaic where you got to mail something in, or we don't mail anything in anymore, but it should be more instant interaction with the caregivers. So I agree. And even Even in the inpatient hospital setting, the best place for a nurse or a physician to be is hands-on patient, talking to them, caring for them, having those discussions that you just talked about. And for a while, technology was hurting that because physician would have to go find a computer to figure out what was going on, then go talk to the patient and have to remember everything from that patient interaction. Or a nurse would, bring in a workstation on wheels, which is a big device that they're bringing into the room. And so when I was a CIO, I really focused on mobility and getting the physicians and the entire care team with more electronic collaboration by using mobile phones or tablets and being able to sit right next to the patient and have those interactions. And so a lot of the technology we're putting in today is really, really helping all this. And it's an exciting time.
Yeah, and so Dave, when we think about what we're seeing, in Canada and the different teams that you're interacting with, how are we looking at these innovations? How have some of these changes after COVID driven innovation or new technology or a new approach with care providers here?
Well, I think that the biggest part that exists is the interchange between a patient and the care provider. And I do believe that technology that exists today is allowing the gap to actually close. And I really believe that information is powerful. Patients want to know what their lab results said. They want to know when it occurred. And I think more of these patient portals exist to allow that flow of information that used to be always hidden behind these massive pieces of paper and huge files that existed in a hospital is now available to the patient, and they can view it, take a look at what happened. And it allows a better dialogue then with the care providers. They also have, and I think about the other telemedicine technologies that exist. Virtual care is one element, but just think about the growth of wearables and the monitoring of health aspects that exist on your smartphone. And you extend that to people saying, I've got this massive wealth of information that I want to share with my care providers. And it's good and bad because right now I think we're running into a dilemma of how and where do we store all this information and who owns it? And all of the things that go along with this massive amount of data that comes across. The number of health apps in the App Store, if you look it up, it's like thousands. And it's just continuously growing. And that allows things like remote monitoring to start to come to fruition, whereby, and I'm hoping we can explore this is kind of the home monitoring, the home hospital that you talked about earlier, KJ, I think is going to make a really interesting environment. And I do believe it'll run into a few things that might add a little bit of controversy is once a person is at home, whose patient is that person? Normally, if you're in a hospital, you're a patient of the hospital and are under the care of the physicians in that group. Now you move to the home. Is it your primary care? Is it other specialists? But it really is going to be a significant benefit for patients in their interaction. I think it will make a huge, huge difference to how people perceive care.
Well, Dave, that's a very good point. You're talking about like where do we store all this data and obviously have to control it or make it more secure. But another problem we're running into that we're starting to solve is, how do you ingest all that data? The amount of data now that we can bring in on an individual patient through wearables, through genomics, through all their healthcare record is a lot for a brain to handle and to be able to handle it and understand what to do about it, right? Physicians are great at what they do, and I love what they do. But nowadays, through AI can help as a directional tool guide them to things that may have not been seen just because of the mass amount of data that's happening. And remember, and a physician's not just caring for one patient, they're caring for multiple patients at the same time. And so it's going to be very exciting to see how we're going to be able to assist physicians as we move forward with AI-based technology to help provide care. I'm not going to say better care, it'll just be more immersive, maybe fuller care because the AI technology can actually literally take all of this data and find trends and stuff and even look towards more population health data based on the diagnosis of the patient, and add all that up and give some guidance to the care team to care for that patient, and then obviously to improve overall outcomes of the patient.
Yeah, what's interesting with that, I think you touched on something I hadn't thought about, which was wearables. And I wear a band and it gathers all sorts of metrics about myself. And you're right, when you think about putting the individual also in the information flow, because you see things like I watch my metrics and I was like, oh, I haven't slept well the last couple of days. Oh, my temperature of my skin is elevated slightly. Maybe I'm starting to come down with something. Maybe I should slow it down for a day or two and get a little bit more rest than I might normally. And you're right. What's interesting when you think about those data feeds is if you're elderly or if maybe you have some type of chronic illness, that's data that your primary healthcare provider could probably benefit from. So Tom, I think that's interesting. How do we aggregate all this stuff? How do we plug some of that day-to-day information into this process as well? And then Dave, I agree, like the idea of the home hospital and how do we continue to provide care and again make people feel more comfortable. Like I'm dealing with my grandparents, like they were most comfortable in their own home. And I think, especially with my grandmother, unfortunately, her decline really was accelerated, I think, by taking her out of the home and the home that she was used to. So I think that's a really important part too, is there's the emotional and the support side of dealing with illness as well and helping your patients. But Dave, if you want to kind of continue the topic there.
Totally, KJ. And I really think this is a really important part. If you really take a look at the average cost in a hospital in Canada for one day in a hospital is around $8,000 a day. Now, that sounds, and it might be a little higher in the US, but I don't know what that number is. But think about how much that costs and the overhead. And that's just the cost of the infrastructure. It doesn't include things like labs and tests and physicians and so on. And in fact, when you compare that and say, how can it work better in the home environment? It's actually proven that there are studies that show that patients recover faster and have better health outcomes when they're actually in the home. And so right off the top, you take a look at the list of the actual capabilities of that home-based healthcare system, the patient experience, the cost effectiveness, better outcomes, and the convenience for the people that are there. It just makes perfect sense. So the technologies are there and getting better all the time to allow that to happen. And the ability to then connect that to the direct caregiver, I think is going to be ground shaking. It really is. And it's can only get better and better the more often we embrace its ability.
Yeah, and also, I mean, it sort of carries along with what we were talking about there a bit ago. It's the personalization of the service and really being able to drive those outcomes and mentioning that not everything needs to be an emergency room trip. Being able to tackle things earlier in the process, have those remote discussions, again, maybe be able to have those data being gathered, and we talk about AI and really part of the change in AI is really concept of being able to bring in more senses, making these AIs multimodal, where it's not just taking in text or taking in data, but it's also able to take in other senses, the sight. It's able to listen. It's able to breathe and detect things that are in the air, et cetera. So I think that's changing. There's a need to get people medical care before things escalate, and accessibility can drive a lot of value there. And then when people do get that care, to your point, the hospital is the best place to have people for certain things, but it's more expensive and not as effective for other things. And so I think it's being able to use the right technology in the right place. And I think the next thing I wanted to ask about was a little bit about the behind the scenes. What are the things that maybe are happening with some of the unsung heroes that work, behind the scenes? So we talk about IT. There's a lot of people who work hard in the IT within the hospital. Maybe what are some of the foundational things that are being done there to build and support these innovations?
The point you bring up, KJ, is that there's a massive amount of things that the IT departments and that are working on behind the scenes that I think are making a difference that probably people are not aware of. And people probably are aware that over time, there's a bigger need for data. And within the hospitals, within the healthcare industry, the demand for bandwidth is growing. And I'll give you an example is, an MRI system, of 10 years ago versus an MRI system today generates a much more significant amount of data that's got to be stored and it's got to be accessed. So infrastructure needs to be developed that allows and supports the use of that. And I'll give you, I do believe that the current MRIs are looking at what they call slices, and they're in the range of 150 slices versus 10 years ago, it might have been 50 slices. And each one of those slices is probably in the range of around 15 to 20 megabytes. So you now are looking at, for one test of one MRI, gigabytes of data. And this is stored and need to be accessed by different people at different times. So you need to build the infrastructure. So that's going on all the time now. So they're building and building more and more robust infrastructures. We touched on earlier about security, and all the outcomes and the dependency now to ensure security is paramount has to be led. And the speed at which, organizations, especially healthcare organizations, need to respond is going up. And you need to start depending on AI, as an example, to automate. We talked about attack vectors and attacks that are happening. This has to happen in real time. Like, it doesn't happen over days and weeks any longer. It's happening over hours and minutes. So we need that in the background. So that infrastructure is being built. That kind of activity is being built. The dynamics of preparing for the future where more and more bandwidth needs to be required. All that type of back office activity is being currently developed and understood that it needs to occur. Even the acquisition and use of AI requires different kinds of laptops, as an example. You now have a new kind of processor in place called a neural processing. People need to think that they have to buy these things in advance now in order to prepare themselves for the future. So all of that infrastructure is continuing to go on, and I know that more of that will carry on to help bring us to what I think is going to be an exciting future.
Yeah, and so Tom, when you think about some of the things that are happening behind the scenes that maybe aren't as right there out in the open that we as patients would see, what are some of the things you're seeing and some of the innovation that's allowing some of these other more visible innovations to be able to happen?
I think Dave did a good job of hitting a nail on the head there. A couple of things to add to that is it's imperative for everybody to be 5 nines these days, right? And 5 nines means you get 5 minutes and 47 seconds of downtime in the entire year. But we care for patients around the clock, and everyone now is reliant on the data and the systems they use to care for patients. So if we go down from a cyber attack or from an infrastructure failure or a disaster, we have to get right back up as soon as possible. So there's a lot of things that go on behind the scenes to create that redundant infrastructure, so we're always on, because the caregivers need us to be always on now. 10 years ago wasn't so bad, but today your gear always has to be up. And then the other thing too that we're seeing a lot more of, and Dave talked about this, about building out that infrastructure. It's an expensive venture to build out AI on-prem, to have in your own data center, and to be able to store and utilize all that data and do the trending and natural language processing and machine learning. And so we're seeing a trend now in the United States where hospitals are now starting to utilize GCP or Azure, AWS, and essentially renting that horsepower to do those large calculations and utilizing the native cloud vendors, AI, natural language processing, or machine learning applications and infrastructure they already have in the cloud. And so instead of you having to buy that and have it on-prem and then to make it redundant on-prem or on-premise, we're seeing a trend now where it's a little bit less expensive to rent it, essentially.
Yeah, it's a good point there. And what's challenging, I think, with a lot of these, the big infrastructure for AI is you have to have that pipeline of model development. You have to have that pipeline of applications and services and use cases, all ready to go if you're going to keep that infrastructure busy. And I know in Canada, Dave and I see a lot of like shared services. One of the groups that we're really proud to work with is Sick Kids Hospital, and they've got a great research team, and they do a lot of shared services with their high performance compute and their AI model infrastructure. But you're right, like. And it's rapidly changing, and so it's not just the investment; it's the investment over time. It's all the storage that Dave mentioned. So yeah, all of that definitely creates some challenges. And kind of on that, I want to pivot to the future state. And so, good question. I think just off the get go, Tom, is how does natural language processing change healthcare, and what are you seeing from an innovation perspective? Because we say AI. But when we really break it down into its different components, I like that because then we start talking about specific use cases. So what does natural language processing bring to healthcare, and what problems does it solve?
Well, it's much needed because healthcare is a conversation, right? You have codified data when it comes to labs and stuff like that, but when you're talking to a patient and going over a diagnosis or writing up a history and physical and stuff, it's conversational based. Today we have this interpreter that's a natural language processing solution, right? So it's looking at the physician note or dictation and pulling out the important data in it and somewhat codifying it, and then you can take that data and put it into a system and do something with it. The best thing you can do with it is add it to an AI system that can then take that data along with other data and develop trends and visualization to allow the physician to make maybe better decisions, because now they have a little bit better directional information from the systems around them. And natural language processing has been going on for a while. It really started with going to electronic dictation. But it's an interpreter. It's required nowadays more than ever. And we're using that data across healthcare.
Yeah, it was the other aspect of natural language processing I find really interesting, and Dave, I'd like to get your comments both on what Tom was saying, but also this is being able to translate that meaning into other languages as well. So it's not only being able to extract the information, but when we think about how do I better communicate, especially across a diverse culture that we have in Canada, when we really need to be speaking the native language of the person who needs the healthcare, because they're the ones describing the problem, in real time as well.
Yeah, I'm glad you brought that up, because I think in Canada, that's one of the really significant opportunities that natural language processing can do. It bridges the language barriers between the care providers and the patient and their families, by the way. It really is an opportunity for, if we have the current environment where you can do simultaneous translation of a dialogue between patients and caregivers, it's very, very powerful. And in that regard, especially in the Canadian context. But I also believe the other ability that I think is going to speed and become more efficient using that entire capability of in clinical documentation, as an example, the ability to translate a conversation in between patient and the caregiver and then document it in the patient record without having the interjection of the provider converting it, using it, and putting it in there. All they have to do is look at it and say, yeah, that's the gist of the conversation and the direction, put it in there. The other part I think that's really interesting too is on diagnosis and treatment as well. I really think that the ability to pull data up and find and use natural language is as it implies easier for the users of that information to pull information away. By using AI, can interpret what they're looking for and get a fancier response to what they're trying to do. I think the entire kind of vertical of the activities that natural language processing can do is crosses many, many, many boundaries and can provide many opportunities to improve the care that's being delivered to the patients.
Yeah, definitely. And I think what Tom was talking about, it's really it's a conversation. We're trying to communicate more effectively. We're trying to store those communications. I think you bring a great point when we think of like the conversation that the patient's having with the doctor or the nurses. That's the raw information. And you're right. If a determination or an interpretation is made at that time, and the only thing we have is the determination, we don't have the raw data, then another set of eyes may pull something else out from that conversation. There may be other clues, there may be other references to other challenges or health issues that maybe are missed. And so that's definitely an interesting thing as well, because once you have that record and you have that conversation and you do have the transcript, then all of a sudden that becomes another area to not just have like AI look at, but also future healthcare clinicians look at as well, right? So yes,
exactly, and I think that it puts it into a pool of data that we're talking about that other types of AI can leverage it to look at research, like the correlation between different diseases, sometimes isn't always obvious. And if you have larger engines that can look at more and more data and that's looking at the entirety of the patient record, and now instead of talking about, a few patients, you're now talking thousands or millions, the correlation between different components becomes even more relevant to outcomes that you never thought were possible. And I think the ability to do it naturally in a language that people interact with within the healthcare system is really, really powerful as we are all humans and use this natural language to communicate. So I think it's a very important aspect of healthcare now and in the future.
So beyond natural language processing, one of the things that I think again has been a staple of healthcare and really driving a lot of value for patients is what's being done with AI and HPC around machine learning models and being able to detect issues more effectively or efficiently, or find challenges or patient issues quicker, so that we can get straight to solving the problem. And I know we invest a lot of time and work with both research and healthcare around AI and HPC. So Dave, what are some of the things in more of the modeling side of things that is driving innovation and is really moving things forward in healthcare in Canada?
Well, I think there's a few things. Well, there's probably many things, but I think about enhanced diagnostics, just the creation of algorithms to analyze massive amounts of data faster, more accurately. I think is huge, and the amount of consumption of data and the use of, as you mentioned, high performance compute is essential to that. Like the consumption of data is massive. I mentioned earlier about the MRI. Just think about the ability to diagnose something, very fast and give as an example, a diagnostic image from an MRI. But you're looking at a population set of, as maybe thousands that have a common issue, that you can diagnose something much faster through AI. But in order to do it, you need the consumption of this massive amount of data. And the other area I just think about is genomics. Genomic data is even larger. And if we're going to be moving forward in environments where personalized medicine is more and more prevalent, to personalize the care that's given, and we talked about, smart places, smart I would call it smart offices, smart people. I'm not sure what I would call it, but whenever you're looking at this ability to deliver the care on a very personal level, the data that's required for that genomic analysis is massive. The other one I'm thinking of too is even drug discovery. I know I attended a session in the US related to trends in IT. And one of the areas they talked about was an AI company called Patterns that was recognizing patterns in different areas and was able to use the algorithms that they created to generate and create drugs, new drugs that are targeting very, very difficult cancer problems and so on. So, and the amount of consumption of and the size of data is massive. So I think that every area you think about, the areas of breakthrough, not only requires the massive amount of data, but the compute power to use the algorithms to generate outputs.
Yeah, so without high performance compute, we couldn't do any of the examples that David just spoke about. I got a couple to add to that too. And this goes back to the MRI. There's a US based company today that can take your CT scan and all the slices, create the patient's heart in a 3D model, and actually show exactly where an occlusion is. So then the physician can do very minimally invasive surgery without having to go find the occlusion, right where it is based off the CT scan and this model, and turn what used to be a very high risk procedure now almost into a low risk procedure because there's no hunting. They know right where it is. They put the stent in, the chemical stent, and it dissolves the occlusion and everything like that. So that's just another example of how high performance compute is helping. Another one too is more video or visual based inference AI, right? That takes a lot of data, obviously. And in one of our, actually more than one of our healthcare transformation centers, we have some visual based AI platforms in there, and they can recognize, when a patient is about to get out of bed, and it can start alerting against it. It can see when a patient gets out of bed. It can recognize when a patient falls. And all the time, it can alert the caregivers to come in and assist the patient. In addition to that, it can recognize when a patient turns in bed, then automatically document that for pressure ulcers into the electronic health record. It can see when the bed is occupied, when it's dirty, when it's cleaned, and waiting for another patient to help with patient logistics and realize that room is ready to go right away. It can also do anomaly detection. So it could recognize that, hey, why is there smoke in this room, and can alert to that. And even go as far as hand washing compliance too, because it can recognize a nurse or a physician and see if they actually went and washed their hands. And that couldn't happen without high performance compute. And so natural language processing, all of our AI modeling, high performance compute are really allowing us to move forward and better care for our patients and to take some of the workload off of our clinicians.
It's really interesting because it's similar to what we talk about with customers around like digitization. How do we take a process? How do we create a digital way of evaluating the state and then do initiate workflows to optimize, in this case, patient care. So it really is interesting, and I think one of the exciting things for me is how many of these processes that we've been able to digitize, we're getting value out of, but then you start to look at all of the other ones that we haven't done yet, and I just look at that and I say, okay, we've come a long way, we've got a long way to go, and even now the technology is changing rapidly. Like you talk about those algorithms. One of the things we talked about on the last episode of the podcast we were doing was really that the tooling to create better technology for AI is getting better. Our ability to get as close to the theoretical, perfect use of the technology is getting better. And those technologies are now driving, the ability to create better algorithms, the ability to really innovate those models. And then, as we've been talking about, Dave, both you and Tom have brought up, all of this additional information that we're generating is then flowing into those models to make them more effective.
When you're talking about the amount of data and the ability to generate the outcomes we're looking for, if you look at the history of AI, one of the critical parameters that you look at is the amount of parameters that are embedded in an AI algorithm. If you look back at some of the very first voice recognition capabilities, you're talking about thousands of parameters. You look at something like Shazam or something, I don't know, some of the earlier ones that were using some AI algorithms, they had limited number of parameters. If you look at ChatGPT version 4, it's 1 trillion parameters. Now think of the compute and capabilities that needs to run something like that. and it's only going to grow larger and larger. I'm not sure what the parameters are in the human brain when you look at the synapses that exist, but I know it's a lot more than a trillion. But still, think about how that's evolved and how that has adapted in the current environment. So the needs are growing in every aspect, from a compute perspective, from a storage perspective, and it's the needs are there, and think healthcare has a lot of need for large databases and data and analytics to support the things that are being done.
Well, David, you bring up a good point, because think how complex care is for one patient. And then, if a hospital supports 1,000 patients, or a physician has the patient workload of, seeing 20 patients a day, it's hard for them to be able to compute all that in their head and focus on it. And so that's where AI really is going to be helping them throughout, across healthcare.
Yeah, and the other thing that was interesting for me was when you look at the workload of some of the positions within a hospital or within healthcare, the number of X-rays that an X-ray technician looks at, and like the volume with all of those thousands of patients is significant, and so again, I think the power for me of AI when I look at that is being able to let's get rid of all of the normal looking X-rays, and let's just focus in on the abnormalities, or within a fairly high probability, the abnormal ones, and make people's time more efficient, spend more time focused on the in this case the X-rays that really need the attention. So they get all of these things, and I think it's a cumulative effect where you're really building efficiencies, and you're improving the process, and you're improving the patient care, and all of these different layers all kind of work together to make that a reality. So Tom, one of the things you mentioned a minute ago, and I just want to go back to, is CDW has some really interesting innovation centers that are in the U.S. and I think you guys are continuing to invest and build there. Could you maybe talk about that? Because I know extended the offer into Canada, where we want to drive innovations in Canada as well, and you guys are doing some really neat things in the U.S. and hopefully we can work out and get some of our Canadian healthcare providers into some of those centers to see what the innovations that are going on there. But could you talk about the innovation centers a little bit?
Yeah, so I'd love to talk about our we don't call them innovation centers, we call them healthcare transformation centers. And today we actually have 5 located around the U.S. Each one of these transformation centers is very unique. We're trying to solve healthcare problems in them. And it's not necessarily solving healthcare problems through technology, but looking at the operations and the workflows that the clinicians are doing, and then utilizing technology to make it better, more or less. And so, like I said, we have 5 today. I'll kind of go through them for you. The first one's called our Thrive Center, and that's really focused on the post-acute and elder market. And so if you go to that transformation center, you're going to see a lot of like smart ovens, smart toilets, VR to educate elders, and more AI-based technology to make sure that they're you can watch their gait and see how they're doing, and more video-based AI stuff. The great thing about that is most of that's connected right to the cloud, and then we can test it and actually run it and do real live demos of that. Our next innovation center is at Intermountain out in Utah. And that one is really where we focus on ideation, data, governance, AI, and the such, and also like AR and VR. And so there we have some level of technology, but it's really more focused on the data side of everything. Our next one is we're about to go live with it with Honor Health, and that is focused on the clinical care command center. So Honor Health is a very vast system in Arizona, and they have command center technology is being used by lots of health systems today. And the value of it is that you can bring patient care, patient logistics, physical security, and physical operations of a hospital all into one room. And you do that to improve your day of discharge, to reduce your you're left without being seen into the ED, which is all like your critical KPIs in a hospital system. So you can really follow the flow of a patient and care and do the things you need to do in more of a command center environment to keep that flowing and to keep your metrics in good standing. And so we have a lab associated with that where we're actually bringing in more platform-based technology to assist in that. And we test it. And the great thing, because it is a transformation center, we can fail fast. We can try something, it doesn't work, we can try again. We're currently building another one out more towards the northwest, and that one's going to be focused on the patient experience. And then the final one I'll talk about, which is more of our flagship today, is our healthcare transformation center that we have at Memorial Care in Fountain Valley, California. And that one is really focused more on patient care. So within this transformation center, we actually have three care settings. We have more of a med-surg care setting that we call patient room next, and I'll get back to that in a second. We also have a physician office exam room. And then we're also building out an acute hospital at the home environment. We had talked more earlier about hospital at the home, but in the US, our Center for Medicare and Medicaid Services is really focused on this acute hospital at the home program, which will allow hospitals to care for patients in the home. And so we're working on what sort of platform-based technology do we need to put there to make it successful and allow that data to flow and to have proper care of patients, even though they're no longer in, a med-surg unit in a hospital. And I keep mentioning platform-based technology, and that's one of the focus areas that we have at CDW is we understand if you have too many point solutions, it's very costly and hard to manage. So when we look at the future of care, which is what we call patient room next, that term is important to us. And what it really means is that we have no idea what healthcare is going to look like in 10 years with technology, and especially with the AI explosion that's changing every couple months now. But we can kind of figure out what's happening today or stuff that's actually in, beta release or just got to general release till about 5 years out. So we spend a lot of time. We have strategists that only focus on that to figure out what sort of technology is needed in these care settings. And then we get it. We put it in, we test it. We have clinicians come in and test it with us, and we work to improve healthcare in general. And that happens as far as what we call it as patient room next, but you actually get to see it in our labs or in our healthcare transformation centers. And so we do typically have customers come in. They'll spend a day and a half with us. Normally it's IT leadership, clinical leadership, hospital operations leadership. And we're really there to talk about workflows and challenges they're having to support their patient care and patient logistics. And then we solve problems with them. We bring in our industry experts. We show them potential futures through our platform-based technology and things that we think will be helpful to healthcare. And then they are able to spend time with us and learn some new things and really kind of refocus their strategy on what they're doing around clinical care and operations with the assistance of technology.
Yeah, what I find really exciting about that is kind of what you mentioned. It seems to me, based on our discussions previously and the conversation we had today, that healthcare is really under a lot of pressure to innovate. You mentioned earlier the consumerization of some of the health, analytics and things that we track. But healthcare is really under pressure to continue to innovate quickly, provide better care, provide care where it's needed, but without the ability to really take on the risk of testing new things. And so I think what's really interesting about the transformation centers you mentioned is it's being able to abstract yourself from your current hospital, see a potential of a new way of not just new technology, but new ways of doing things, new processes, and being able to undergo that testing and have that conversation without the risk to your patients. So that's really, anyways, I find that really exciting. I think that's it's an investment that we've made, but I think it drives a lot of, value before you're ever making any of those technology purchases.
When I was the CIO, I had my own, right? But the problem with my own, it was really close to my production environment, which added some risk to my organization. But the other thing is that I didn't always have time to focus on it. And what you had mentioned before about coming out to a visit to one of our transformation centers, spending time to talk, that's one of the biggest values for the health system that comes out is because they get to sit in a room for a day and have these discussions that they never get to do back at the hospital. And then with these discussions, we bring in our industry experts to help guide them to an outcome that meets their needs and that they desire. It's every time I go to one of our transformation visits with our customers, I always walk away smiling because I know we helped them improve healthcare somehow in their organization.
I was just going to say, Tom, I think they're very exciting opportunities, and I'm looking forward. I'm currently organizing some time to come down to your one in California. I haven't talked to Corey yet to confirm it, but he's helping me try to get one organized so I can see what it's all about in real time. But one of the things I just wanted to add to what you're talking about in terms of innovation, healthcare by nature is a very conservative, risk averse entity, right? If you think about it, they're very risk averse. And I think that the opportunity to have access to an innovative center to see what's in the realm of possible, I think alleviates some of that concept of risk and allows people to be more open about the opportunity to innovate. And I think that's a very exciting part and the side benefit, definitely, of those transformation centers.
Yeah, and that's been one of the really interesting things about being part of like the larger CDW organization is the ability to have some of these investments into, again, like a transformational center, and not just one, but multiple, focus on different aspects of healthcare. Again, like our healthcare providers can't get there alone, and so I find that really interesting. I definitely have learned a lot from both of you and the extended team. So let's close out the conversation, kind of on future state. And I know, Tom, you said it's hard to pick 10 years down the road where we're going to be. But if we think 5 years and you think that sort of shorter term, what's something that is maybe currently out of reach with, it's something we're not able to do today, but you feel that we're maybe close to that's really going to change things in the future. And I'll give you an example, something I'm thinking about, and something Michael Traves, one of the other guys I work with, he and I were talking about, and that was there's this term that they throw around out there in IT, the digital twin, and the idea of creating a digital version of something that's in the real world, but then obviously augmenting it with other bits of information. And one of the things that's kind of kicking around out there is the idea of having a digital twin of yourself, so a digital twin of KJ out there for healthcare, like being able to, as I think Dave mentioned, personalized medication or personalized services and support, or being able to take in my specific genomic makeup in the process. But Tom, like am I crazy? And then also, what's an example of an innovation that you think maybe we're close to, or that's it's happening here in the near future that you think will really change things up?
That's a really good question. I think the digital twin is something that'll happen in the future. One of the things, though, that where we're at today is that we have a lot of new things coming out very fast. And when I was a CEO, the biggest challenge I had was adoption of technology with my caregivers. And so one thing we have to focus on is the things that we're seeing right now that are out there, is that our caregivers adopt them because they find value in it. I think the digital twin will have that. There's no doubt about it. And it's going to be heavy AI based. And I think it'll help a lot of our populations to be able to understand their care because of it. Another thing, too, that I think will be happening sooner than later, and this isn't my idea, it's actually Fred Holston's, who's our CTO. He used to be the CTO at Intermountain, and he runs our healthcare transformation centers for us. Is but using more visual indicators in patient signage when you're going into a room or in a room. So a physician can quickly glance at a chart and realize mostly why the patient's there and where they're at in their care at any given point in time. When I saw that, I'm like, that would really be effective because of the fact that healthcare is complex, care is complex, and the easier we can make it for our physicians and nursing staff to care for patients, the better we'll be.
Yeah, we used to have a term that we talked about, pivoting, and going from being 100% focused at one thing and pivoting and being 100% focused someplace else. And you're right, when you think about, like, nurses and orderlies, doctors, like all the people that are engaged, you're 100% focused on one patient, and then you're spinning and you're doing a different task, or you're 100% focused on another patient. So no, that's really interesting. And I do have to give a thumbs up to Fred. Fred's awesome. Again, just, one of the team members I really enjoyed talking to. Dave, when you look at here as we go into the future, what's something you think is near term or here in the near future you feel that will maybe shake things up and change things all over again?
There's a few things that come to mind, KJ, that I think are really important. I really like the concept of a digital twin, not only working at a patient level, but also a digital twin in other spaces, like in the use to help create, let's say, a smart hospital, which includes all of the things that we're talking about. I'm thinking about nanotechnology, with that can target and kill, cancer cells, by generating a radioactive isotope that delivers something very specifically. These things are coming, but I think and this is kind of a leap. It's not as much as it is on, related to technology as much as it is to how it will actually change healthcare, is an innovation that won a Nobel Prize back in 2020 by two doctors, one in the U.S. and one in France, Dr. Jennifer Doudna and Dr. Emily Carpentier. They came up with it's called CRISPR-Cas9, and I'll spell that CRISPR/CAS9. And I won't go into what they are, but look them up. What it does is it's a technology for gene editing to find and look at and modify, slice genes, whether it's in humans, in any kind of space, in plants, animals, you name it. And the ability to actually find a mechanism, and they found it through a natural mechanism, something to do with how bacteria fight off viruses. And they found that they basically snipped the DNA of the virus and stopped it from spreading. And they basically did research to find out how you could actually cut and insert into a DNA strain something that is maybe a defect or something that has an impact on disease. Or one of the things I read about on this area was amazing is to help with climate change. And you go, well, what's the contributors of climate change? And it's things like methane produced from the millions of cattle that are out there. If you can modify a gene to reduce the amount of methane producing, you might have an impact on reducing, CO2 gases and reducing the greenhouse effect. So when I looked at this, the extent and breadth of this, it's here now and being vastly implemented in all kinds of clinical trials across the world. So it's pretty amazing. Anyways, that's not exactly in line with the technologies that we've been talking about, but it is what I think might be a breakthrough in disease control and addressing even therapies and so on.
I think it's a good one to close out on, and what's really interesting there is we're seeing so many of the research, so much of the research that's being done, in educational institutions, with healthcare institutions. It really does have relevancy sort of across, into other areas, and so whether it's pharmaceuticals or healthcare or genomics, or it is pretty exciting, and I think we talked about some of the challenges today. I think we talked about some really interesting upside and some of the things that you guys are seeing and our healthcare providers are giving us. Thank you again for joining me. I really appreciate it. Tom and Dave, it's always great to chat with you guys, and you always bring interesting ideas and you make me smarter, which I love, because I like to talk to our customers, and I love getting you guys in front of them as well. So thank you again for participating. I really appreciate that. I've been your host, KJ Burke. Thank you both to Tom and Dave for joining us. Thanks for listening to the podcast, and tune in to the next CDW Canada Tech Talks podcast, where you found this one.
Thanks, KJ. Thanks, Tom.
Yeah, thank you all.